Everyone. Thank you so much for joining us today. I'm Allison Elsner, and I'm the Executive Director for the San Bernardino County Medical Society. And we're excited to welcome you to today's webinar, Inland Empire Health Information Organization, Connecting Providers to Patient Information Through Data Sharing. And what we want to do today is really help everyone understand how your practice can be involved in the HIO, the Health Information Organization. As an ambulatory or primary care practice, you can actually be a part of the HIO for free. And what that means for you is that as a primary care physician practice, you can immediately begin to participate in data sharing services for treatment at the point of care. It will enable you as a physician to provide enhanced care, reduce readmissions, operate more efficiently, and be more responsive to the patient population. You're going to hear more in just a bit about the relationship between the IEHIO and its partner on a statewide level, ManifestMedX. And ManifestMedX is the California HIE, the Health Information Exchange, that shares data among 600 healthcare organizations across California, including hospitals, health plans, ACOs, and other ambulatory groups. And for us, this is exciting because it includes almost all hospitals in the Inland Empire. So again, we want to remind you that as an ambulatory practice, you can join ManifestMedX and the HIO at no cost to you. And it's really vital that we encourage you to get involved in this so we can continue to make progress in enhancing care in our area. So today we are very honored to have two wonderful professionals involved in this effort with us. I'd like to introduce Jenna Arellano, Administrative Director for the IEHIO. And I'd like to introduce Lacey Mendoza, Director of Customer Success for ManifestMedX. So before we let them start, I do want to remind everyone this webinar is being recorded. So we will have this posted on our website following, probably later today or tomorrow, and we will share with our colleague at RCMA, and who, by the way, is the force behind this entire effort. And also, if you'd like to ask questions, we will leave some time for questions at the end of this presentation. Please go ahead and use the chat feature on Zoom. And when we're ready, we will have Soteria go ahead and ask those questions and we'll get them answered for you. So at this point, let's bring in Jana and Lacey, and welcome, ladies.
Good afternoon, everybody. So my name is Jana Arellano. My name is Jana Arellano. I'm the Administrative Director for the Inland Empire Health Information Organization. So what that is in short is the IEHIO. Now, many of you may not be familiar with the Inland Empire Health Information Organization. You may not even be familiar with ManifestMedX, who is the statewide, California statewide HIE. But the Inland Empire Health Information Organization has a long history in the Inland Empire, and what our whole purpose is to connect people with data. Now, how we do this is we coordinate data sharing services within the Inland Empire to improve the health of the community. So today we're talking about our partnership with ManifestMedX, again, the California HIE. And our partnership is with Manifest to share the data through the Health Information Exchange for the ambulatory providers, but also the hospitals within Riverside and San Bernardino County. And introducing the Manifest side of this is Lacey Mendoza with ManifestMedX.
Thank you, Jenna. And thank you, everybody, for joining. My name is Lacey Mendoza. I'm the Director of Customer Success for ManifestMedX. For those of you who do not know who ManifestMedX is, we are actually a nonprofit organization. We connect healthcare in California, and we've actually built a nonprofit utility that gets health information out of silos. We share health records for over 20 million people. We have over 400 healthcare organizations, including over 90 hospitals, with the biggest footprint being in Riverside and San Bernardino counties, which is fantastic for you all. And we also have quite a few health plans, including Anthem, Blue Shield, IHP, and HealthNet. So we'll go on to this next slide. I'll let Jenna talk a little bit, and then I'll go into more information about Manifest.
As you see, Manifest MedX is very robust throughout California, but especially in the Inland Empire in the Riverside and San Bernardino counties. Almost all hospitals within Riverside and San Bernardino County are sharing data in one way or another with the Manifest MedX. But what does this really mean for the ambulatory providers and the practices within our communities? It means that we provide a technology to help you keep you informed with your patients. So you can receive, through this technology, receive notifications on your patients, really be informed about if your patients have been admitted or discharged from the hospital. You can go into the platform and find records, whether it be on labs or any type of studies that they had within the healthcare, the hospital walls. You could go into the Manifest platform and be able to retrieve those records without having to go through the medical records department or having to fill out the forms or, wait those long period of times that it takes for health records to get you the information that you need. So at this time, we give you the visibility also to the medications list. So what that means is if your patient's in the hospital, what medications were they prescribed to within the hospital, and there's that gap of knowledge sometimes when they leave the hospital and what they could actually provide the providers and the staff on what exactly happened within the hospital walls. So this is something that Manifest provides, is that information of what's going on with your patients, and that way you're very well informed with this information. Go ahead, Macy.
So as Jenna stated, pretty much we have quite a few products or tools. I like to call them tools because these are things that will help you get something done, right? It makes it more efficient. So we have 3 of them. MX Notify, which is exactly what it is. It's notifications. It notifies you when patients that are attributed to you have been admitted or discharged from a hospital. One of the great things that we do have now as it relates to COVID-19 is we are actually sending in positive lab notifications. So if your patient has tested for COVID-19 and it was a positive, you'll receive it within MX Notify. Just note that we only receive the COVID lab notifications from organizations that are a part of MX. And then we have MX Access, which is our longitudinal health record. It includes both claims and clinical data, so claims from those health plans that we described earlier. Those include medications, allergies, procedures, documentation, discharge summaries, progress notes, even radiology reports. So it's a holistic view of taking a look at things. Notify and Access work really well together, especially for ambulatory providers. You can come in, see who's been admitted or discharged in real time, and then go into Access and get a better view or better sense of what's happened to that patient. And you can reach out to that patient. A lot of hospitals have that, follow up with your PCP in 2 weeks. You'll have that information on your patients already. And then we have MX Analyze, which is our newest population health dashboard. You can see risk trends for your patients. It is a beast of a tool. It has a lot of information around it. I'm not going to go too much into that because there's just so much that this tool can do, but we can definitely help you understand a little more if you would like. But around COVID-19 as well, we have a few filters that I'll talk about here shortly that could help you and your organization with your patients. Let me go on to the next screen here. And so the next few slides, what I'm going to do is just discuss quickly what we're doing as it relates to COVID-19. As we know, it's not going anywhere for a bit. So it'd be nice for you guys to get a sense of what we've done to help. And then after we talk about that, I'll show you in real time what our test system looks like and how it kind of functions together. So with MX Access, which is the longitudinal record, basically for COVID-19, if your patient has tested positive and we've received that result, we have a nice little banner at the top of the screen there. You'll see COVID-19 positive in red. That way, you all don't have to dig through the record before knowing that your patient or individual has tested positive. So if you want to go directly to the lab, you can do that. If you want to go look at documentation around that, you can do that as well. So that's one piece that we're doing, especially around MX access and COVID-19. MX Notify are notifications for lab notifications, as I discussed earlier. We have the portal option of you being notified when your patients have tested positive. But if you would like to know if your patient has tested both positive and negative with test results, we have the option to provide a daily batch file for the last 24 hours for those notifications in an Excel file. So it's easy, and you can either do one or the other. You can get both. We have quite a few organizations who choose to do both. They want to know in real time when their patients have tested positive, but also they want to see who's been tested and has either had a negative or positive results, and do some data manipulation of their own. And then MX Analyze, which as I stated, is our population health tool. As it relates to COVID-19, we have a couple of filters that we put in place for you. One is COVID-19 outreach, and this is more of a proactive approach, right? So we identify individuals within your population who have had a diagnosis in the last 12 months that relates to the increased risk of poor outcomes, things such as cardiovascular, immunocompromising conditions, cancer, etc. We take all of those, put it into a filtered list for you, and all you have to do is click on that filter and it provides your patient list. You can download that list of your patients and do a proactive outreach to get a sense of, what's their temperature been, how are they feeling, all of that. And in that file, it includes date of birth, age, gender, and we also include the phone number for that outreach. And then we have the COVID-19 cases filter. Basically, this is who in your population has, one, either been diagnosed with COVID-19 or has had a positive lab results. So you can use this filter to identify individuals who should be flagged or followed up with to provide guidance on monitoring their symptoms. As you all know, not everybody is admitted when you get diagnosed with COVID-19, but this gives you a chance to follow up with your patients and let them know what is the next steps. And then this last slide here that I have before we move into the live section is I just wanted to give you a sense of what this filter looks like, especially in Analyze, our population health tool. If these slides get sent out to you, I just want you guys to have that as a reference. Okay, so what I'm gonna do now is I'm actually gonna go into our training environment. And as you can see, there are the three tools here on the side with the three icons, and I only logged in once, which is great. That means you log in one time, you have access to the three tools. You don't have to log in 3 separate times. I'll just quickly go into Analyze real fast. Like I said, it is a huge tool. There are different modules within that. So much data behind it with risk scores and all of that. You can even see within your population the top chronic diseases, which is fantastic. But let me just quickly show you the filters that we have in place. And you can do it by gender, age group if you'd like. So there's a bunch of different things that you can do with this. But you just come into attribution, you come under your customized cohort, and you have the choice of either doing the outreach, like I stated, was those that have the higher risk, and then the cases which let you know who's been diagnosed or have a positive result. All you have to do is click on it, apply your filter, and everything in this module gets updated with the filter you put in place. So then all you would have to do, and you'll see too, the chronic disease changes with your filters as well. But all you would have to do is come to your patient list, click on load the list, and you have your list of patients that you need to do the outreach on. So that's our Analyze tool. But the two that I want to show you that it would be really great for you all is Notify and Access. So we'll start with Notify, because Notify is a great way to get a sense of who's been admitted to discharge, right? This is a way for you to come in and see who you need to follow up with. It is in real time. You do have an option to download it to Excel. You can add filters. You can filter based off of anything that you would like. If you want to do it by certain facilities, you can do that. If you just want inpatient, you can do that as well. For this patient here, you'll see that is an outpatient test result, and it is COVID-19. And then down here, you can see tested positive. So you'll be able to see that, hey, your patient has tested positive for COVID-19. If you want to come down to an inpatient notification, it has all of the demographics. You don't even have to leave this page to see any of your patient demographics if you don't want to. You have the phone number, address, date of birth, all of that. And then this is the most recent information around that visit. It also includes the number of inpatient and ER visits in the last 12 months. So you can see if these are frequent flyers. You can see if they've been a part of certain care programs and who that care manager is if we receive that information. And then the event history provides you information around the last events for that patient. So you'll see they've had a COVID result, they've had an ER discharge, an admit, and the list goes on. So you'll get to see that. So once you go into Notify, you look at your patient, you want a little more information on them, you can click into Access. And we have something called patient context. And the great thing about that is once you click on that patient and you click into Access, it automatically takes you into that chart. You don't have to go into a patient search. You don't have to remember any MRNs. It's all right there for you. As we showed you on the slides prior, you'll see the banner here of COVID-19. And then we have little icons in here that provide you a little more information. You'll see that things are highlighted in red, abnormalities, etc. You click on more demographics. That includes all the demographics plus MRNs related to that patient. So if you were to call another facility, you already have the MRN associated to that patient. And then we also have view summary for those that like to get prepared ahead of time for your patients. You can click on view summary. And this is a downloadable and printable summary for your patients. So it includes allergies, meds, everything that you're going to see for this patient in your longitudinal record is here. You can print it out and put it in the chart if you'd like. So just quickly, this is the summary screen. As you can see, it's a summary that includes allergies, meds, procedures, diagnosis, and all of that, last recent encounters, and laboratory results. You'll see here that we do have the COVID one. If you click the little blue button here, it's another pop-up, and it shows you the results. So you can get it from here. You don't even have to leave that first screen. If you want to go into a little more detail around each, they each have a place over here. So you can see allergies. We even have the most up-to-date insurance, right? So we have active insurance and we have inactive. We keep the inactive in case you want to see what was prior. We do have claims data. So you can see here that we have regular claims, the medical claims, and then we have the pharmacy claims, and we split those out for you all as well. Medications, so you can see recent for the last 90 days. Any historical is moved down to the bottom. One of the things that I want to show you is labs, which is great. So you'll see here, anything that is in red always means it's abnormal. You'll see cumulative report here. So if you have multiple results, you have the option of having a cumulative view here. But also, so we're going into documents. You have the X-ray documents, so the reports in there, and then you also have the documents section as well here. So there's a ton of information around these patients that is within this, this longitudinal record that we get from a bunch of the hospitals within your area. So you're not even having to reach out to a lot of these hospitals and wait the 24 to 72 hours, even on stat medical record requests. These are all available at your fingertips. You just sign up, you get a login, you have access to these 3 tools. So with that, I'm going to go back into our, let me get back to the page. And I will hand it back over to Jenna, who has a little more information to provide you.
Yes, thank you so much, Lacey. So as we can see, there's a lot of information available and a lot of advantage in using the HIE. Lacey did speak about minimizing wait times into getting some of the patient records and having labs available. And I will add that there is a relationship with LabCorp and LabQuest. So as our patients go out to the communities to get their labs, that information is populated into the platform, as well as RadNet, so the radiology reports, not just from the hospital base, but from the community-based level as well. So the HIO, we're in partnership with Manifest, and right now what we're offering is some incentives for the ambulatory practices that are CalHOP eligible. So right now we're offering $5,000 if your practice is 25 providers or less, or $10,000 if you have 25 or more providers. And this is really an incentive money to help offset any of the costs that it may incur, that your facility may incur as you get connected and participate within the Manifest MedX. And there are some implementation costs that may occur, and we're really prepared to kind of have those conversations and talk about those subscription fees with Manifest. And so we have Greenway, Practice Fusion, eClinicalWix, Athena, and NextGen are some of the vendors that we're helping offset some of those implementation costs, or some of the notifications that may occur to implement those technologies.
And just to go off of that too, Jana, a lot of these vendors are chosen because it's an easy connection. You know, it's an EHR vendor that we're working with as a hub, which means it's a lot easier to provide that information and get connected.
Correct. It's an easier task than if it was to be something outside of those realms. So as we said, we are in partnership with Manifest MedX, but in order to get signed up, you do go through the Inland Empire Health Information Organization. My contact number is available on the flyer, as well as on the link here and on the slide here. So I highly suggest just email me, reach out to me, give me a phone call, and we'll be able to get you the necessary information to get you signed up into the HIE.
Perfect. And I think that is the end of our slide.
Great, so we're ready to do some questions now. So we're going to have Soteria jump in and start going through the questions that have been submitted on chat.
Sure, absolutely. The first question, is the information such as lab results in real time?
Yes, yes, they are. They are real time. It is real time data. So as soon as they are documented and sent to us, we send it to you.
Okay, great. This other question, to participate, does a provider need to be on EMR?
Yeah, you will have to be connected into an electronic medical record. There are specified, like we just discussed, some specified EMRs that are easy, turn on the switch to get connected. Some of them may take a little bit legwork, but we do offer access. So any ambulatory provider could get access to the HIE and sign up for free. So there is absolutely no cost to having access to the HIE.
Great. How about UC visits? Will they also be available?
If they're a participant of Manifest MedX, then yes, it will be.
Great. Do physicians practice practice participants need to be RCMA or SBCMS members to participate in the IEHIO?
That answer is no, they do not. They just need to reach out to me. We'll get a contract signed, and that's the first step in the process. It's really an easy process to get access to Manifest HIE. The first part of it, though, is signing a contract. I will add, though, we just want to put out there that in order to get some of the technology, we will require a list of your patients, and there's some technical components to that. But in order to get the notifications on whether a patient has been admitted or discharged from the hospital, we need more information and some connectivity. And that's where some of the implementation of this incentive money and subscription fees that we're ready to have those conversations about come into play.
Great. Now, how about Office Alley?
That's not currently part of our list for this round, is it, Jenna?
It is not on the current list. However, if they have Office Ally, we could still get them access. But they're not part of this particular list in the ambulatory project right now.
For the incentive piece.
For the incentive piece, yes.
Now, what is CalHOP?
That is a great question. So CalHOP
this is Jeanette from Manifest MedX. Can you guys hear me?
Did you want to speak on that, Jeanette?
Yeah, let me speak on that. Hi, guys. I am the program manager for CalHOP at Manifest MedX, and I'm the person that is best equipped to answer this question. So basically, CalHOP stands for the California Health Information Exchange Onboarding Program. And this is a state and federal funded grant program to help Medi-Cal providers get onto these HIEs in California. So there's a few milestones that it consists of, but basically the idea is the state wants to encourage more Medi-Cal providers to get onto an HIE and share patient data across different facilities. There's a letter of intent that is part of this ambulatory recruitment initiative that you would sign if you're interested in participating in CalHOP, and then we would help you achieve the different milestones. And they're pretty straightforward. They're just sharing kind of the basic data that we typically would get if you were to join our HIE. But this helps encourage Medi-Cal providers to get onto the HIE, and we're using this funding to make our services free to all ambulatory providers. So this is really key because we're not charging any ambulatory providers anything for our services. So this program helps make that possible.
Wonderful. Now, are pediatric practices encouraged to participate?
That answer would be yes, they are.
Okay.
This project is open to all. We'll give all. We don't deny any of the ambulatory practices. There are a subset of practices that we are reaching out to, but we're not going to turn anybody away from getting access to the information.
And now, do we have to inform the patient about this MedX manifest?
It is encouraged to inform your patients that their data is being sent to Manifest MedX. We actually do have resources available for you all as far as brochures, notice of privacy practices, all of that information, which is on our website that you can utilize to inform your patients of what Manifest MedX is. And if they choose not to want to send their data to us or to opt out really, they have that option, and we leave it in the hands of the patients to do that by two methods. One, we have an 800 number during normal business hours, and we also have a web form which they can fill out anytime, or somebody else can fill it out on their behalf if they choose to. That will take effect as soon as that's submitted. So both options are available for the patients.
Great. Now, are you also interfaced with California Immunization Registry?
We are. We can forward the immunizations to CARE, or the California Immunization Registry. We are currently not receiving the immunizations back at this time.
Okay. To be CalHOP eligible, do you need to be contracted directly for Medi-Cal, or if we are Medi-Cal providers through IEHP?
So this is Jeanette again. As long as you are serving Medi-Cal patients, you can be eligible. So I believe both of these scenarios would make you eligible.
And that's all I have for questions.
And just also as an update, for those that are on here that would like to do a little more in-depth, have a little more in-depth demo, there are standing meetings every Tuesday and Thursday that MX has, or Manifest has. Just reach out to Jana. She has all of that information and could help provide that info to you.
Great.
And Jana, why don't you type your email once again into this chat box here so people have that handy on this screen. So looks like we don't have any other questions. Are there any other comments or any part of an overview that any of you would like to continue? Dolores, do you have anything you want to add? You're on mute, Dolores.
Okay, I was able to unmute myself. Hey. No, I just encourage, I'm Dolores Green. I'm the Executive Director with Riverside County Medical Association, Allison's counterpart in Riverside. And we have been working on this health information exchange here in the Inland Empire for over 10 years. And we really, really encourage the physicians and other healthcare providers to participate, because this is a tremendous benefit. And 95% of the hospitals in the Inland Empire are participants, which means that they send live data to MX in real time. And so our biggest complaint we always heard from the physicians is they have no idea what's happened to their patient when they're in the hospital, and they have no idea when they've been discharged. And as we all know, as we're moving into value-based care and the need to see patients within 7 days of being discharged, et cetera, this is a very, very valuable tool to help you be successful. And again, it's the value that MX brings is absolutely no charge for the ambulatory practices to participate in MX. There could potentially be a charge from your EMR vendor, and that is what that incentive program that Lacey was talking about and Jana were talking about. But again, your specific information or details, they could discuss with you one-on-one. But we have the largest footprint within MX, meaning we, the Inland Empire, and it's really, again, I can't encourage you enough to consider signing up for the HIE. Thank you, Allison.
Thank you, Dolores. You're the expert on this, and we do want to reiterate how much work you've done in this space. You're the force behind it, and along with, I know, IEHP for many years. So you've done a lot to advance the quality of care in the Inland Empire. I see we have a couple of other questions. So Daria, do you want to jump in and do that?
Sure, absolutely. This first question is this not a duplication of what the IPA does?
So with MX at least, I mean, we are providing data from a ton of different resources that you have available to yourself. There's no, as Dolores and Jana stated, there's no participation fees. you get, discharge summaries, all of that. And just to go into the second question there, if participation with manifest will eventually be mandatory as opposed to voluntary, we do not make it mandatory for you to participate. This is completely voluntary. We don't see it becoming mandatory in the future, but with the information that we provide you in real time with no cost to you, should be helpful to you, especially as, trying to fill in gaps of care that you don't already have. So as it stands right now, it is not mandatory, nor do we see it being in that direction anytime in the present future.
If I could jump in and address the IPA issue, because I think the important thing to recognize is a lot of people have the vision that they get all the information they need from their medical group or their IPA, but that is only within your four walls, if you will, or within the IPA's four walls, not the 400 or 500 organizations that are contributing data. And as we all know, patients don't stay in one place. They may go out of network. They may be in San Francisco on vacation and get sick. Could be a variety of things. And for managed care patients, HMO patients, you do have a little bit more control that they have to go to specific providers, but it doesn't happen all the time. And your PPO providers or your fee-for-service Medi-Cal providers that may be going to, other physicians that you don't know about, but you're their primary care physician, this helps you get the information that wouldn't be available elsewhere.
Thank you.
And I wanted just to, real quick, Allison, I'm sorry.
Yeah,
I wanted to add a little bit more on to Dolores's, because I know that in our presentation we say a large percentage of, almost 95% of the hospitals in Riverside and San Bernardino County, but we also have some of the major healthcare providers like RMC and Riverside Medical Group contributing their data. So what I'm trying to say is that it's not just the hospitals, it's the community organizations as well that a lot of our patients go to and get care from.
Wonderful. Well,
go
ahead.
do you want me to ask the next question? There's one more.
Oh, I missed it. Yes, sorry.
Yeah, no problem. Will participation in MedX eventually be mandatory as opposed to voluntary at present? What if you no longer?
We did that. I think we just answered that, right?
Did that
Yeah,
one just go?
and just that very, very last question, what if you wish to no longer participate?
Right.
You always have the option to terminate.
Okay, perfect.
Thank you. Well, if everyone is sure you don't have any other questions, this is your chance right now while we have the experts on the line. Thank you, Dr.
Oh, I love that comment.
That's a nice comment. We are an IPA and we love MedX. Wow, we like hearing that. That's great. Way to go, MedX and HIO. That's awesome. All right, so Jana has just reminded everyone of her email address here. So feel free to please reach out to her if you would like to join HIO or if you'd like more information. If you just want to get more details about what it would involve for you, please email her or any of us. You can email any of us at SBCMS or, of course, our counterparts who spearhead this project at RCMA, Dolores Green, and the staff there. So, all right, we thank you all so much for being a part of this today. This is really important that we raise awareness about that so we can get as many of you involved as possible. So Jana and Lacey, thanks for a wonderful presentation. Really some great information. And Dolores, thank you too.
Thank you all.
All right, everyone. We'll have a lovely rest of your day. And don't forget, this will be on our websites as a recording. So we will talk to you again next time.
Thank you.
Thanks, everyone. Bye-bye.
Thank you.